You are most welcome, ladies, for the Female Lawyers Network. We are so happy and honored to have you as we wait for the numbers to grow. We are going to immediately start at 4:35, but you're most welcome. We are humbled to host you this afternoon. As you're all aware, the Female Lawyers Network Can you hear me, ladies? Yes, can you hear me? Isabel, can you hear me? Dr. Justin, can you hear me? Saying that you are most welcome. We are so honored and privileged to have you this afternoon. Doctor, can you mute, please?
Yes.
Can you mute? So you can hear me very well. Thank you, Doctor. Good afternoon, ladies and women in law, and all the friends of the Female Lawyers Fraternity. We are so privileged and honored to host you this afternoon. The Female Lawyers Network believes in empowerment of women, but most importantly, we believe in information sharing, knowledge acquisition, and also inspiring and motivating one another to develop and grow better in the legal career. We've had quite a number of sessions in the previous weeks, and many of them were hinged on how best we can navigate the legal career. We've had engagements on child raising and the nuggets that we need as women in law. This afternoon, we have yet another beautiful session about the reproductive wellness of the women. You'll agree with me that reproductive health wellness is very critical and important for us women in law. It's an area that we need to focus on as we progress in our career. We cannot progress well and scale up in our career if our reproductive wellness is not well handled. So we decided to host someone to take us through what we need to know, the lessons we need to know, the aspects we need to consider. How should we handle the different areas in our reproductive health that affect us to the core? Aspects like hormonal imbalance, aspects like infertility, aspects like fibroids. How do we detect? What are the causes? What are the risks? Are there any possible treatments? So we are here to engage in a very fruitful conversation. I just want to thank each one of you for joining in. Many of you have sent in questions on our official email. Please let the questions keep coming. And most importantly, I want to thank Dr. Justin for allowing to come and have a beautiful conversation with us. We believe in learning, and we can only learn by receiving information from one another. So today's conversation is about the lessons from a gynecologist. It's about what we need to know about pelvic inflammatory diseases. Like you all know, information is power, but knowledge is superpower. So we need to grow in our knowledge. We need to grow in our information so that we are able to exercise the power as the female lawyers, as the women in law. So ladies and the women in law, allow me this afternoon to introduce our chief speaker. She's already here with us. Allow me to clearly say that Dr. Justine Walusimbi Ngobi has extensive medical practice of over 20 years. Dr. Justine is an obstetrician gynecologist. She is also a public health specialist, and she's currently a director with Henrob Hospital. She also runs her own medical practice clinic called the Gabriel Medical Specialist Clinic in Nyanama. Dr. Justine is also a laparoscopic surgeon, and I believe we are going to ask quite a number of questions in this area. And she's also a career woman. She's a mother of 4, and she is married for over 20 years. I believe you'd agree with me that we would not choose any other better person like Dr. Justine Walusimbi Ngobi. She has the vast experience, she has the knowledge, she's also in private practice, but also serving in Henrob Hospital. And like I shared earlier on, she has been able to also work and serve in Zambia Hospital for quite a number of years, until recently when she left in 2019 and joined as a director in Henrob Hospital. So this afternoon, allow me to introduce Dr. Justine. She's going to share with us quite a number of lessons that we need to know as regards our productive wellness. She's going to address all the questions you'd ask any other person. How do we maintain a healthy reproductive system? So ladies, women-in-law, friends of FLN, allow me at this juncture to invite Dr. Justine Walusimbi to address us. Doctor, thank you so much for allowing to be with us this afternoon. I know we are stealing time meant for other, patients, but you're most welcome.
Thank you very much, Joyce, for that humble introduction. Good evening, everyone. And I'm very glad to share a little that I can with you. And I pray that we shall have a participatory meeting and be able to share something with you. Can you hear me? Joyce, is that okay?
Yes, it's okay. I can hear you, doctor. We can hear you very, very well.
Yes, so these days, the commonest people we find in our clinics are people who are struggling with infertility, especially women who are starting their families quite late. Career women, we do a lot of schooling and then we start getting married quite late. Some are getting married in their 40s, late 30s. And the commonest problem is infertility, failure to have a child. And we have found out that the commonest cause of that is actually pelvic inflammatory diseases, what people call PIDs. It's a very common occurrence. Someone tell, I think I have a PID, I think I have a PID, I have a pain here. So we thought that we'd start with that, address it in detail, and then touch the other small, not small really, but the other reproductive health concerns. And if you want another topic to be elaborated, then we can do that another time. Yeah, so I think we are going to start with with pelvic inflammatory diseases, and then we shall proceed accordingly. Okay. Yeah. All right, so what are these pelvic inflammatory diseases or PIDs? This is a spectrum of infections or inflammation that affect the upper female reproductive system. I will show you briefly in simple terms what it looks like. And it is usually an ascending infection, which means that it starts from down here in the vagina and then it goes up into the cervix, into the uterus, and the organs that are around it. And it is very common in the young sexually active women. So this is how a reproductive system looks like for a female. This is the urinary bladder. This is the uterus. These are the tubes, and these are the ovaries where the eggs are stored. So with the bladder, we have this tube called the ureter. Is also what you see here that receives urine from up, Yeah, so it receives urine. These are the kidneys. Commonest topic of discussion these days in Uganda. These are the kidneys, and this is the tube that brings down urine up to the bladder. So if you get an infection in the urine and you don't treat it, it can also go up here and have an effect on your kidneys. So that is why treating a UTI is also very important. And also during our surgeries around this area, we may have an effect on one of these organs. So in brief, this is the uterus, the inside of the uterus. This is what we call the cervix. And this is the birth canal. These are the tubes, and these are the
Allow me to apologize. Doctor has network issues. She's probably returning, but those who have just joined us, you are most welcome. We are basically having that introduction to our reproductive organs as women. Doctor is back. Doctor, you're most welcome. You have basically stopped the part where you're telling us that if we don't treat the UTIs, then we are likely to get issues in our reproductive system. Doctor, kindly unmute and continue with the discussion. Yes, Doctor, we can see you now. Kindly proceed.
These bacteria are called Neisseria, gonorrhea. I think we've all heard about gonorrhea. Then there's another one called chlamydia. It doesn't cause a lot of problems, like you will not see any symptoms, you don't feel anything, but it's the most notorious for damaging our tubes. Then there are also some bacteria that are usually resident within the vagina that can actually go up and cause problems. So once the organs, these organisms are within the system, they produce pus. Then that pus acts as glue, and it makes all the organs I talked about stick together. The tubes may swell, fill with pus, they may get clogged, they may get pasted onto other organs like the uterus, the ovaries, or the abdomen. And this pus is also sexually transmitted to the partner. So on healing, the strings of pus become thick bands that hold these organs permanently together. So you find everything, as I showed you, held together in form of a small ball. And sometimes they store pockets of pus for many years. And these will give you a lot of pain, a lot of problems, and especially failure to conceive, because the tubes will be closed off. This infection may also go to other organs like the liver, as I'll show you. So who is at risk? People who start their sexual behaviors quite early, young people who are below 25 years, people who have sex very frequently, number of sexual partners, some people on the very wide sex network, some they may not even be aware of. Then also, if you get an infection and you treat yourself, you don't treat your partner, then you get reinfection. And then people who have had sexually transmitted infections are also at risk. What are the symptoms? Most of the time, there is no symptom. You will not feel anything when you get this infection. But some people have low abdominal pain, which lingers on for a long time. If the infection is very, if the infection is very big, you may have a fever, abnormal discharge. But most, as I said, don't have any symptoms. Then, of course, later in life, someone will present with failure to conceive. They'll get married and they try to conceive for some years and it's just not happening. And it's usually the commonest reason why people see a gynae. And then we work backwards and find out that they actually had a PID sometime in their life. Then others have long-standing pelvic pain, especially during their menses. So the signs may be a raised temperature, abnormal discharge, and then when the doctor is examining you down there, you feel a lot of pain. That could be a sign that there is PID. So it is also difficult to diagnose because most of the time someone has no pain, they have nothing. But we usually diagnose it from the symptoms that someone presents with. The swab may also be negative. So that's why sometimes we don't even do it. But when the pelvic pain is uncontrollable, laparoscopy is recommended. We put a camera into your abdomen, we look in and we see what is happening. Usually we put 2 small holes and then we may take samples. So this here is, there was a very bad infection, but actually this is part of the liver. So this pus went up into the liver. Above here is the diaphragm and the lungs. So this infection pus collected around here and then it caused these strings you can see. So the liver is actually tightly held onto the abdomen. Skip this. So this is also what it looks like when we check you, when we do a laparoscopy, we put a camera into the abdomen. Sorry about that, I think it's not showing very well. Yes, as you can see, these are strings. This was pus that later formed strings. So the uterus is held up here by a string. There's another string here. This is the ovary. You see the strings I'm talking about. This was once pus. Now it has held everything together. So the uterus is held onto the abdominal wall. This woman has so much pain every time she gets her menses. You see the ovary down is also held up. So everything is kind of sticking together. So those are the effects of the PID. This is what actually happens inside there. So everything is stuck together and there will be a lot of pain. Sometimes you find that also the appendix is put down into and is attached onto the uterus. So what else can it be? Sometimes it's not PID when someone has low abdominal pain. It may be endometriosis. Endometriosis happens when someone bleeds and some of the blood backflows into the abdomen. And it also becomes sticky and holds things together. Sometimes it's the appendix that is sick. Some people just have painful periods when they don't have a cause. And then sometimes it is just fibroids that are causing this pain. So not every low abdominal pain is actually a PID. It could be something else. And that's the reason why when you have pain that is lingering on, you need to see a gynae. So endometriosis is when the blood comes and then it is collecting around the uterus. So you find that when someone bleeds and then they have this reddening around. It's also very, very painful every time they have periods. Sometimes it's a cyst, like this one. We found that she had a very big ovarian cyst. So that can also cause you pain that is similar to a PID. So what are the commonest effects? The commonest problem is chronic pelvic pain. Someone has pain, they can't even work. Then failure to conceive is very common. And then a constant foul smelling discharge that is very disturbing. painful, heavy menses. All these things affect the quality of life. Someone is in pain, they are always visiting the doctor, they are always taking painkillers. They are not themselves. And you cannot be very productive when you are facing this kind of health problem. So what can we do differently? From our discussions, of course, with our patients, we found out that some of us, we are maybe very smart in class, we do very good jobs, but sometimes we also don't make the best moves. We don't make the best choices. So sometimes we end up with the wrong people, drug addicts, and then we become at risk of these things. For some people in our area, the damage is already done. We can't undo anything, but we can only maybe treat. So what we can do differently is to delay. Each woman here is either a mother, an aunt, taking care of some young people. Let's do everything we can to delay that first sexual debut. Then we also encourage monogamous relationships. Sometimes they are not possible, but it would be the best. And then those who can't, they try to use barrier methods and then treat infections promptly. Don't just buy medicines, go for a good checkup. And then those who use oral contraceptives, they have an advantage. They thicken the mucus around the cervix and then prevent the bacteria from ascending. So, any questions there, Joyce? Joyce?
Yes, doctor.
Yes, one about PID. Can I take some questions before I attach other things?
One of the questions that has come in is basically, should women now consider that any painful symptom is a sign of PIDs? Because someone has sent in a message saying that ever since they started their menses, they have pain and they've been taking painkillers and since secondary days. So probably you can clarify on that.
Yes, if someone has pain that affects their quality of life, that affects their daily activity, that wakes you up at night, it has to be checked. It may be a PID, it may be the other things I talked about. The other commonest is endometriosis. It's very, very common. People have painful periods, they should find out why. Let's not just buy medicine off the counter. You need to find out why. It could be something that may later become very debilitating. So they need to see a gynae and find out the cause of their problems.
Then the other question is, thank you so much, doctor, is you've spoken about the bacteria in the vaginal area, which forms into pus. The question is, how should a woman prevent such pus formation? Because as you've explained that there are no symptoms at all physically, what should a woman do to prevent any of those bacteria resulting into a serious medical hazard?
The commonest cause is douching. Most women do a lot of douching. That area is not like the mouth. It doesn't need to be brushed or washed or anything. It washes itself. So we should stop douching, putting things, when the women put a lot of things down there and interfere with that normal bacteria. And then also, if you take medicines like antibiotics for a very long time, you destroy the normal environment of those bacteria, and then they get into overgrowth and may actually become disease-causing germs. So that's the hygiene around that area. Some people overdo it. And in the process, they end up causing more harm than good.
So is it correct to say that the best way for that area to be properly cleaned is to consider the external cleaning and not, do any
cleaning, and that's it.
Okay, and that's, so it is more or less self-cleaning internally.
They should change them regularly.
Oh, okay. So, doctor, you can proceed as I receive more questions here inbox.
Okay, let's touch the other areas that people wanted to be talked about. One is fibroids. Fibroids are growths that happen around the uterus. The uterus has about 3 layers. They usually happen start growing in the middle, but they may be within the cavity where the baby grows, or they may be on the outside of the uterus. They are usually non-cancerous unless someone keeps it for so many years. And the cause is usually not known, but we have seen them to run in families. So you find sisters having, if their mother had a fibroid, maybe they also have a fibroid, and they are just common among African women. They usually don't cause any problems, but sometimes they may, depending on where they are located and their size. So they may cause abdominal swelling, heavy or prolonged menstrual flow, low abdominal pain. They may cause bleeding. They may also cause infertility. So some people they feel pelvic pressure. Some will report they can fail to conceive. Others have frequent urination. Some feel a mass in the lower abdomen. That is when it has really started growing. So every Black woman is at risk of getting fibroids or having them. But also people who start their periods below the age of 9 are also at risk of getting fibroids. People who are overweight, if you have a family history of fibroids, people who have a high blood pressure, and then there are also women who completed their families way too early. You find someone has had all their 5 children below the age of 25. So they have a lot of their reproductive life when they're not having any children. That can also put you at risk. But you should note that we have seen fibroids in young women in their 20s. And we've also seen fibroids in women who have had children. Someone has their children, complete their family by about 35, and by the time they are 45, they have fibroids. So they can happen now in any age group. So this is what they look like. They are big swellings. And as I told you, the uterus has 3 layers. This is the outer layer, the middle layer, and then the inner layer. This is where the baby grows. So their effect depends on where they are located. So this fibroid, however small, will give you more problems than this fibroid, even if this one is bigger. So even this one will give you more problems than this one. So what they can do usually, they cause heavy flow, miscarriages. A woman is likely to have a, oh my God, what did I do? So, what we do usually, you need to seek assessments, you see a gynae, and we assess the size, the location, and what you need. In a few cases, we may give medication, but most of them actually need surgery. The common is we found that a woman is diagnosed with fibroids and they spend 5 years to make a decision. Even a simple surgery becomes very complicated because the fibroid has grown, it has changed, it has become complex. So surgery, ladies, is safe. It can be open surgery if they are so big, or we can do laparoscopy. But when they stay for very long and become very big, the surgery becomes very difficult. And surgery for fibroid is very safe, and it can be done in this country. There are so many gynecologists who are very good at doing this. So you don't need to travel to just have your fibroids removed. The other topic they wanted me to talk about was infertility. All these topics are very big topics. They need their own time, but I'll just touch a few things here and there. When do we say someone is infertile? We think a couple is infertile, or we say a couple is infertile if they have failed to conceive after 12 months or more of regular uninterrupted intercourse, and all 6 months for females who are above 35 years of age. And it is a disease of the male or female reproductive system. Sometimes it is the one part of the couple or both of them. In males, it is caused by tubal blockage or abscess or low sperm, problems with sperm production or motility or its movement. In females, there may be structural abnormalities or diseases or disorders of either the uterus or the vagina or the ovaries. There may be abnormalities in hormonal production, what we call hormonal imbalance. And then some are caused by the environment where someone stays. Issues like obesity and smoking are also big contributors. Then we also say that infertility may be primary if someone has never conceived before, or secondary if someone has had a child but failed to have another one. So the tubal diseases usually are a result of untreated sexually transmitted infections or PIDs or complications of abortions or scars from previous surgery. Tubal fractures are the commonest cause of secondary infertility. Sometimes the tubes may actually be absent, or they may be cut during previous surgery, such as in tubal ligation. So sometimes it's the uterus that has a problem. It may not be there. Someone may be born without a uterus, or it may have abnormalities. So sometimes we have inflammatory diseases like endometriosis. We may have fibroids. Then there's also another condition we call adenomyosis, when the middle layer of the uterus thickens abnormally. And then sometimes endometriosis, adenomyosis, and fibroids all occur at the same time. Sometimes we have foreign bodies within the uterus, like someone may have an abortion, but then not all the parts were expelled. So you find they have some fetal bones within the uterus, or some people put an IUD and forget all about it, and then end up with infertility. Sometimes infertility is caused by hormonal imbalances. Menstruation and conception are controlled by hormones, which are produced in the brain, and they come down onto the ovaries. So if there is any abnormality in that connection, the woman will have problems. The ovaries may also have some problems like polycystic ovaries, where the eggs produce fluids and start secreting their own hormones. So that can also cause infertility. What should we do? After 12 months of failing to conceive, or if 6 months, if the woman is above 35, the couple should seek help. Then we need to assess and find out where the problem is. But there are some times when we cannot find a problem. There are also couples that have had children in previous relationships, but together they fail to have a child. So some conditions cannot be treated. For example, if the woman has an absent uterus, you can't do much about it. But there are solutions like surrogacy, adoption, and most of the treatments for infertility are also available in country. We can do intravenous, we can do in vitro fertilization, we can do insemination, we can actually inseminate cells into the uterus, we can do surrogacy, and all these are available with very good success rates. But remember that usually it's the woman who comes along. But we need to remember that there is also male infertility. Found in about 40% of couples, you find it's the man who cannot have a child, but the blame is all put on the woman. Yeah. Anything about those two, or we proceed? Joyce?
Just wanted to respond to these other questions that have come in. Someone was asking that, are all fibroids supposed to be removed? Because someone received information that there are fibroids that can be overlooked and they don't have any complications whatsoever. That's number one. Number two, the question that has also come in is that, is it true that menopause with a reduction of estrogen after menopause, that the fibroids can shrink and reduce? Therefore, if somebody has them from the 40s, they can as well ignore them until their 50s, because they will subsequently shrink. The other third question is, what is your position on the use of local herbs in the treatment of fibroids? Then the other question was, you've shared ably that the big fibroids normally need open surgery, most of the big fibroids. And however, the small ones may require laparoscopic, surgery. Is the open surgery a high death risk? Because, someone is asking, can you share with us the likelihood of someone losing life in the course of an open surgery? And then the last one about fibroids that has also come in, where someone is sharing that they have a fibroid that is apparently outside the uterus and is probably, seated on the bladder. Is it fatal? Because the message is they've regularly interfaced with a gynae because of different UTIs. So what is your position and what is your advice on that? Maybe after those questions on surgery, on fibroids, then I can share the questions that have come in as regards infertility from your presentation. Over to you, Doctor.
All right. As I said, fibroids is a topic on its own. It's quite wide. First of all, we don't touch them unless they cause problems. Usually, if you have a small fibroid, it's not having any problem, we should not operate fibroids that are not problematic. So we only operate, because as you said, during menopause, most fibroids, if they are small, they will shrink and they will not cause issues. So we operate fibroids because they are causing problems. The commonest problem is abnormal bleeding and pain. Those are the commonest reasons why we remove them. The choice of open versus laparoscopic surgery depends, one, on the size of the fibroid, and two, on affordability, because there's a significant difference in the prices. But it depends on the size. Laparoscopic surgery is recommended because the instruments used are very small. It is cosmetic. It gives you quick return to your daily activities, less pain, less bleeding, and less short hospital stay. You can have a same day. You can have it like daycare and you go back home. So that is with open surgery, you may have to miss work for about a month. It's more painful, there's more bleeding, you're more likely to have a blood transfusion. And that's why we normally don't recommend it unless the fibroid is so big. That's when we opt for open surgery. And we are saying the ladies here should not wait for fibroids to become like sizes of babies' heads, About local herbs, I'm yet to find a woman who has been healed by local herbs. Most of the time, after spending so much, they always come back to the gynecologist. And usually what we have observed that the local herbs actually make the fibroids meshy, more difficult to remove. The surgery becomes complex, but they are not, I've not seen any. Because I always ask people to come back with a scan showing me the results of their herbal medicine, treatment, and I've not got any. Endometriosis is also very common, and it's best treated laparoscopically. So the medicines don't work. They really don't work. You need to actually remove that layer that is abnormal laparoscopically. Yes, I think I'll complete a bit and then go back to the other questions.
Doctor, allow me to present these other questions that are already in the chat room. Someone is asking, can a doctor help us differentiate between normal and abnormal discharge? Then the other question is it possible that PCOS is hereditary, the polycystic ovarian syndrome? And then another question that I'm reading in the chat room is, can endometriosis be treated, especially with someone with one ovary? And then last question is, to what extent would you recommend someone at 40 years to go for tubal ligation? Thank you, Doctor.
I think anybody can differentiate between what is normal and what is abnormal according to them. And it is you who presents to me telling me how your discharge is abnormal, really. Yes,
Okay.
I think everybody knows what is normal for them. It would be very difficult for me to start describing. Polycystic ovarian syndrome can be hereditary, but sometimes it can just happen. Yeah, endometriosis can be treated even if someone has one ovary. And if we treat it laparoscopically, it's when we get the best results. Tubal ligation is usually done when someone is sure they have completed their family. So really age doesn't count. For me, anybody above 35, I think they are old enough to make that decision. So age really doesn't count. Once you have the children you feel you have, or sometimes we think it is dangerous for you to have another child, tubal ligation is recommended. Thank you. I think let me complete this bit and then we proceed.
All right, doctor.
Yes, so reproductive health through the years. We're talking about our reproductive health. Our reproductive health starts at about 5 weeks. When the baby is, this is an embryo fetus of about 5 weeks. Sorry. And by then, all the ovaries are already formed. All the eggs are within the ovary. The organs have started forming. And at this time, most women actually don't even know they are pregnant. So many times they cause a lot of harm to their babies, to their female babies, or even male babies when they are not even aware. So the lifestyle of the woman, if they are smoking, drinking, they're on contraceptives, women who are now on, who take that Chinese pill, the once a month pill, we have found out that the offsprings actually now start having premature puberty. So the things that are done around this time can actually affect the reproductive life of a woman. Then 21 to 45 years, this is when we make reproductive choices that may affect old age in the future. This is when people make a lot of mistakes that usually affect their reproductive health. The PIDs come in around this time, the complications of abortions. Some people delay to go to the hospital when they are pregnant. And then you find that maybe they get complications during pregnancy and childbirth, they lose the uterus. So many things happen around this time, but the commonest concerns are also about pregnancy, childbirth, and breastfeeding. Infertility also tends to pop up around this time. And then this is also when we start other medical problems. People find out they have high blood pressure, high blood sugar. These ones also have an effect on reproductive life. People with high blood sugar are likely to have abnormal discharges. People with high blood pressure are likely to have fibroids. And then these are also the most productive years where the quality of life is very important. So if someone has chronic pelvic pain and they are missing work, they may actually lag behind in their career. And then above 45, that is when the perimenopause or menopause. These periods stop. Once periods have stopped for 12 consecutive months, we say someone has reached their menopause. So it may be asymptomatic. Some people have no issues, but others have hot flashes, dryness, they have issues with sleeping. But life can still go on, especially those who have no chronic illnesses or have a good relationship. So the most important thing at this time is to stay hydrated, have an active life. Those who can continue working, to keep working if they still have the energy for it, and to also have their annual gynecological checkups. So we also wanted to talk a little about the HPV. This is a human papilloma virus. It's a sexually transmitted virus. It's commonest cause of cancer of the cervix. Cancer of the cervix is the commonest cancer that causes death among women in Uganda. And cancer of the cervix, ladies, is very painful, is very, what can I say? People People with cancer of the cervix are very difficult to manage because it's a very smelly disease. So you'll find that nobody wants to look after you. And the problem with it, it's almost a case of negligence because it grows over 15 years. It gives you a lot of time for you to check it out. You're supposed to have your cancer screening regularly. If you have your cancer screening regularly, you cannot have cancer of the cervix. So it's almost a cancer that gets people who are really careless in that area, I should say. We should not have cancer of the cervix here. So the HPV vaccine prevents the growth of cancer-causing virus and it protects us from the cancer of the cervix. So we should give it to our daughters from the age of 9 up to 20 years if they are not sexually active. And then those who are above 21 to 65 should have their annual cervical cancer screening unless you've had 3 consecutive negative tests from the last sexual encounter. So as you can see, there's a lot that has been done to prevent it, and we should not be dying from it. So finally, reproductive health is a human right, and every woman should have an enjoyable reproductive health life. And reproductive health choices should be personal and should be made with correct information. We are ladies, we are mothers, we are aunties, we are grandparents. Many times we make wrong decisions for our female relatives and we get them into trouble. The choices we make in that area, the choices we make for our sisters-in-law, our young sisters may affect them. So let every woman make their choice, given the information that she has. And all females are unique. There's no one size that fits all. So when you have a problem, seek information. Don't take information that was given to your sister or your mother to correct your health problems. So gynecological care is available. All gynecological care is available. We have very highly trained gynecologists around here and very good centers. So personally, I don't have a gynecological condition that I can refer. We can manage everything in country. So let's support women, support working women through pregnancy, childbirth, and breastfeeding. Those who are employing, please give women paid maternity leave, allow them to breastfeed and to recover from their pregnancy. And even those who are struggling with childbirth, child loss, infertility, let's support them. Let's curb efforts, let's support all efforts to curb gender-based violence. Gender-based violence means that people who are in that kind of relationship are likely to have PIDs, are likely to have miscarriages. It contributes, they are likely not to attend antenatal care. It contributes a lot to maternal mortality in our country. And let's support all efforts to stop teenage pregnancies. They are also the greatest contributors of maternal mortality and morbidity. And let's have a healthy reproductive lifestyle and make informed choices about our health, our reproductive health. Thank you. So any other questions are welcome.
Thank you so much, Dr. Justine. Of course, quite a number of questions have come in. We appreciate the discussion that you've really shared. Now, one of the questions that has also come in is, can you give us your take on the hormonal imbalance? Because women struggle through what is called hormonal imbalance. How should it be handled? What nuggets of wisdom would you give the women in law as regards the aspect of hormonal imbalance? The other question is, someone is still asking on fibroids. They've undergone open surgery, and 3 years later, there's regrowth of the same fibroids, but much bigger and more in number. What advice would you give that person? Number 3 is, how does someone who does not have a uterus have menses? Can you please educate us on that just slightly? Because you mentioned earlier on that certain infertility is also attributed to the absence of, a uterus as a young girl grows up they fail to, to have one. Then if the case is so, how would you advise us mothers to detect absence of such a critical organ in our daughters early enough? What would you advise us? How can a parent quickly detect this? Because we've seen, like, for the men, young boys are normally, when the babies are still young, as they go to different pediatricians, they feel their testicles to determine whether they've descended down into the sacs. So can you give us your take on that? Then the other question is, male infertility is lately very common. However, because of the aspect of patriarchy, the women remain fearful to combat it. What would you advise, or what are gynecologists and obstetricians doing in order to ensure that as you treat the women, you're also involving the male spouse, so that you can be able to find a lasting solution? So maybe you can handle those other questions as I recall these new ones that have come in. Thank you, Doctor.
About hormonal imbalance, it is usually detected if a girl fails to start their menses from the age of 9, between the age of 9 and 16. So that's because the start of menses is the sign that the reproductive system is complete and it's functioning. So you get alarm bells if the girl is not starting their menses between 9 and 16 years. And that's when they should be investigated. And sometimes that's how we discover some of these things, that maybe someone has a missing uterus or it is abnormal. The other cause is sometimes you find a girl who fails to develop breasts, has a hoarse voice, is masculine, they have a beard. So that sometimes they are the sign that they have more of the male hormone than the female hormone. And others, of course, we discover when a woman fails to conceive, then we do tests and we find their hormones are not in good balance. So the best thing is to actually have an assessment, because there are so many hormones and some are low, some are high. So the individual needs to be assessed and we know which hormones are actually not in sync. And about the fibroids, yes, if the fibroids are operated before someone is in the menopause, they can actually come back or they grow back. So that's why someone is assessed and we do the operation depending on their needs. The best treatment for fibroids is to actually remove the whole uterus. That's when you treat them permanently. But when you remove them, there's a risk that they will grow back. So you manage the person accordingly. Also, what happens usually, someone is treated, the fibroids are removed, but they fail to conceive. And after a period of 3 to 5 years, the fibroids are grown back. So usually before we operate the fibroids, we need to have a plan. We need to have a plan with the patient and do what is best for them. If I get a nun at 30 years, I just don't remove fibroids. If she's not interested in starting a family, I just remove the whole uterus and cure the problem once and for all. But also the other problem, most women cling onto their uterus even when it's no longer serving the purpose. The uterus is a bag to carry the baby only. Outside that, it actually has no role. So if you've completed your family, your uterus is giving you problems, don't think twice about removing it. It is a very safe operation. Yeah, I think that is it.
Thank you so much, Doctor.
Pardon?
Yes, there was another question.
Which I've answered. I've seen a question about fibroids. They can grow back if they are removed. They will grow back definitely.
Okay, now there's another question in the chat room, Doctor. Someone is saying they have signs of candida, but every time they take tests, they are told that they are only yeast infections. And they are claiming that the symptoms are persisting. What would you advise such a lady, Doctor?
If they have persistent yeast infection, maybe they've become resistant to the available drugs. They could be resistant and they maybe need a simple procedure to clean out that infection, that yeast infection. Yeah, she can inbox and I help her out.
All right, so please inbox the doctor as soon as we are off air for purposes of further clarification. Now, the other question is about contraceptives. Someone has sent in a message that there is information that some contraceptives foster cancerous cell growth in women, specifically, contraceptives like the no plant, the insertion in the, in the arm, and people have reported signs of breast lump growth and other symptoms. So what is your take on that, doctor?
About contraceptives, nobody should start contraceptives on their own. You need to have an assessment and see what is best for your situation. As I said, there's no one size fits all. Have an assessment and see what is best for you in your situation. Some contraceptives can't be used by some women. So if you use contraceptive and for example, you use pills and you are not supposed to use them, then you may get problems. And of course, sometimes one fails and then you may have to be switched on another. So the best thing is for people to have an assessment before they start. Most people just use what their friends are using and it may not be safe for them. Let me also take this opportunity to warn ladies that if anyone is on that Chinese pill, please throw it away. That pill is not recommended. It has very high levels of hormones. It causes a lot of problems. And it is actually not recommended. It's not registered in this country because it is harmful. It is fancy, it is once a month, seems to be easy to take, but it is very, very harmful.
Thank you so much, doctor. Now, a question is coming in. What would you tell a young woman that is in perimenopause seasons of their lives? What nuggets can you give them to prepare for menopause? Because one of the most creepy thing for any woman is that the fears that have been attributed to menopause, mood swings, the hot flashes, the different issues that have been shared across different spaces on the challenges of menopause. So what would you tell a young woman who is in their late 30s and is probably, moving a journey towards the perimenopause seasons of their lives? Then the other question that I thought you'd also add on is, how should a woman who has already started menopause thrive and enjoy the season regardless of the medical challenges that are associated with menopause? Thank you, doctor.
Menopause also has a lot to do with the state of mind, the kind of relationship someone has, their social circles. Sometimes the more you know, the more harmful. Because when you go up country, the village women don't fuss so much about menopause like us. It is a transition, and some women go through it so smoothly, others struggle with it, but it is also managed. For example, in Mulago, there is a clinic now every Monday that is just handling this situation. So if someone has problems with it, they can see again, because still it is individual. Every person goes through it a little differently. The symptoms that we read about are very individualistic. Some go through it with a lot of symptoms. It's like also periods. Some people have very painless, others have very painful. It's the same thing. Every woman is different. And if something is quite abnormal, is affecting quality of life, then you seek for help.
Doctor, can you please explain further about that clinic so that we can all know, is it free? Can someone with menopause simply walk in and be able to access, quality services? Kindly clarify more on that.
Yeah, the clinic is now the Women's Specialized Hospital in Mulago, and it runs on Mondays. So if someone goes there, they can easily be helped.
Okay.
Yes.
And how about the cervical cancer screening? Are there free services? We've had that there.
The clinic is
So most
this
hospitals.
clinic is, pardon?
So which hospitals?
Most gynecologists do cervical cancer screening. So you go to the gynecologist of your choice. The clinic in Mulago is on the, runs on, it's every Friday, 9 a.m. at Silver OPD. That's the Mulago Specialized Women's Hospital. It's Fridays from 9 at Silver OPD.
Okay. Thank you very much.
Yeah, most gynecologists do cervical cancer screening. So you can go to a gynecologist of your choice.
Yes, women, I believe you've heard that clearly, that we need to go for cervical cancer screening Friday at Mulago Specialized Hospital. We can get more information on that.
No,
then
that
we
is,
also need
that is for menopause. That's the menopause clinic. But
the menopause clinic.
Yeah, that's the menopause clinic. For cervical cancer screening, most gyns can do it. And people who are above 40 should do it annually. And people who are above 45 should have their gyne checkup once a year at least.
Okay. So, ladies, I believe we've heard that very, very well, that we need to do regular, we need to do assessment of the contraceptives that we take on. You don't just simply walk into, just a pharmacy and, try any contraceptive somebody else is trying. So it's very important for us to have a clear gyne assessment alongside our different, blood makeup. And also the cervical cancer screening, that women above 45 should do it once a year. And of course, any woman should do it annually so that we're able to tell early enough and detect any signs and symptoms. And I'm glad that you've also shared the menopause clinic at the Mulago Specialized Hospital. Now, doctor, the other question is there, can you discuss the role of nutrition in a good reproductive health? Are there particular specific nutrition that we should subscribe to in order to be able to have very good, reproductive health wellness? And the other question is stress attributed to cancer, especially the women? Because we've had the different, stories and versions that, stress can trigger cancer. Can you give us your position on that with a clear emphasis on women?
Cancer is caused when the normal cells start reproducing themselves abnormally. And yes, stress can contribute. Stress can significantly contribute to developing cancer in any body organ. I think the best thing for us via nutrition, and we all know these things, having an active life, some form of exercise, eating our healthy food, eating our vegetables and fruits, and also having a work-life balance. Some people are workaholics, they don't do anything outside work. We should balance out our work, have time for work, have time for leisure. There are people who never take leave. They work all the months of the year. So we need to have a work-life balance. Develop social networks. Family is very important to keep someone healthy. Because on top of our reproductive health, we also have the other there's mental health, yes, but also there are other medical issues. If your health is not okay, then the medical issues will affect you and they will eventually affect your reproductive life. Thank you.
Thank you very much, Doctor. That is very, very insightful, that we need to consider our nutrition, but most importantly also have work-life balance as we navigate the legal career. Can you give us your take on the cysts? Because these days it's very common that women are being told now and again that you have these cysts, you have these cysts. What are the causes? 2, do all the cysts need open surgery? Thank you.
Cysts are usually caused by changes in our hormones. They are usually a result of hormonal imbalances. Sometimes they can also be a result of infections. So the treatment of choice is laparoscopic. If laparoscopic, it becomes a daycare surgery, less pain, less bleeding, and a short hospital stay. Yes, they are quite common, but they happen at all ages. Usually they are common once someone starts menstruating, and they can happen. Any cyst above 45 years should be removed also immediately and investigated because it can be cancerous. So once they tell you you have a cyst, please do more investigations and have it removed if you're above 45. Thank you.
Thank you so much, Doctor. We want to thank you so much because we are coming towards the end of our fruitful discussion. And for those of you who have just joined us, today we're having a beautiful conversation from Dr. Justine Walusimbi. She has ably taken us through what we need to know as women in law as regards our reproductive health. We began the presentation by Doctor showing us through a video and also a diagram how our reproductive system looks and the need for us to take good care of it. Just as a recap, Doctor emphasized the need for us to desist from insertions, internal washings, or what they call douching, as purposes of maintaining our reproductive health. Why? Because we end up interfering with the bacteria that is internally there, and that ends up affecting us. So doctor has advised us that we need to have regular assessment of contraceptive use. It's not that women need to just walk into any clinic or probably any health center and you say, for me, I want to use a coil. For me, I need to use this. We need to have a clear assessment. And also what I've picked from the discussion today, that I believe every female lawyer should have a gynecologist. Why? So that we are able to have a deeper conversation on issues that we cannot easily pick from others. There's also a very good discussion that you've ably taken us through on the need for us to have a check on our hormones. If they're imbalanced, you've ably shared that there are treatments that are clearly stipulated for hormonal imbalance treatments. And I've also picked from your conversation on uterine fibroids or fibroids that are outside our uterus, the need for us to have a structured conversation with our gynecologists or obstetricians on the need either to have an open surgery or laparoscopy. But like you've ably shared, it is person to holder. It's what the doctor will give us that will determine. Ladies, we've also had the conversation on cysts, the need for us to have regular checkups. If we have cysts, we either undergo what we call laparoscopic, or surgery so that they are able to be handled. And for those that are in the perimenopause stage, the stage towards menopause, Dr. has ably shared the need for us to visit the Mulago specialist hospital every Friday. There's a menopause clinic. And for those who are already in menopause, we can still get a lot of information. Like I shared earlier on, information is power and knowledge is superpower. So we are here as the Female Lawyers Network to make sure that we enhance our knowledge. Why? Because a good reproductive health system will be able to give us a very good mental state, which will enable us to perform and excel very well as the women in law. Doctor has also hinted on something very important, the role of nutrition and stress management. We need to eat well, exercise, but most importantly, we need to manage our stress. Why? Because stress in the long run affects our reproductive wellness. The other aspect that doctor has also tackled very well is the aspect of the pelvic inflammatory diseases. that most times the symptoms are not obvious, but they affect us in terms of fertility. So ladies, I believe all our questions have been really tackled by Dr. Has handled the need for us to go for regular checkups, regular assessments, have a conversation on the aspects that are very pertinent to us, and then we are able to get the requisite treatment. Doctor, allow me to thank you so much for today's conversation. It has been very insightful. We've learned a lot. I don't know what you can say in the last 3 minutes as a wrap up of your today conversation before we finally close today's meeting. Over to you, Doctor.
Yes, thank you, Joyce. Ladies, let's take care of our reproductive systems, our reproductive health. If you have a problem, please report to the doctor. And if there's anything you don't understand, ask and get elaborate. You can even get a second opinion, but go and see a doctor. It's very hard when you find someone and they've had a condition for over many years and it's too late, you can't do much. Or they lose maybe a uterus or an ovary that could have been saved if they came earlier. So please do your checkups, do your cervical cancer checkups. Usually I advise people to have friends, 2 or 3, and then get a month in the year and you're like, this month we go and do our cervical cancer. So you look out for each other, go and tick off that. Make sure every year you call your body and do it because it saves a lot of lives. We are losing a lot of women unnecessarily because of just not screening enough. Have your cervical cancer screen, because as they do that, they also do your breast cancer screening, and then see a gynae once you hit 40. Start visiting a gynae regularly so that we can look out for things that we can treat early and improve our what. And also during pregnancy, some of us are too busy to seek help. Someone comes to the antenatal clinic when they are about 5-6 months, they've missed out on a lot of information and interventions, or they feel pain and sleep over it. Pain is a sign that something is not right. So we should respond to it and seek help. I wish you all a nice evening. Thank you.
Thank you so much, Doctor. We are so honored and privileged this evening for a very, very insightful presentation. We have learned so much. I believe that women that are sending in quite a number of messages have picked so much from today's discussion. Thank you so much. And for the women in law that have attended today's session, thank you very much for fruitful participation. We are honored and privileged that every Friday you take off time to join and participate. I believe we are learning and growing by day. And at the end of it all, we will have a very empowered, informed, and knowledgeable female lawyer. We wish you a beautiful weekend and God bless you. Thank you very much.